Dr. Anderson here talking with Kay. We have a patient here by the name of Kay. And Kay had some procedures done about 6 weeks ago. And she's been so kind to talk to us and tell her story. And she's doing quite well at this point. I think she's saying she's maybe 70% better, mainly symptoms of restless leg. And we've been doing this now for roughly 3 to 4 years. We've been noticing that there are a couple of particular tunnels that we're able to open and open the tunnels, do a decompression surgery, we call it, on those tunnels and get relief. So if we could just talk to you for a second, Kay, just kind of tell us what the symptoms were like, and now you're 6 weeks out, and then just let the people watching this know about what it was like.
Okay. I had been going to a neurologist, and he was treating me for restless legs. The medication I was using giving me some bad side effects that I didn't like, and I was ready to get off it. I weaned myself off. I came in here for another procedure, and I mentioned that this was a problem of mine. I wondered if there was anything that could help that I read about in your brochure. And so we talked about this. I've been having jerking, unable to sleep at night. I'd have to get up, walk around, get back in bed, try to get back to sleep, still couldn't. It just wiggle, kicking, just that sort of...
not sleeping.
Not sleeping. When you don't sleep, you're not a very happy person.
Well, you seemed happy when you came in. It didn't seem too irritable at all, but that's good. So, but it
has helped. I noticed right away after the diagnostic injection, I could tell a big change. Before the surgery, you know, I was still, it's hard to differentiate which leg's giving you the most grief. The other one was wiggling around. But since the surgery, I have felt like I have a much better outcome when I try to go to sleep. I can actually know now that it's the right leg that's jiggling around. The one you did surgery on is quiet. And that's good.
And the left one was worse than the right, but the left one now is better than the right.
Oh yeah.
You're saying, And so if I can point this out for people watching, this is an incision for what's called the common perineal nerve tunnel right here. And then if we come on down a little further, this is what's called the superficial perineal nerve. And these seem to be the two problem areas that we see does help quite a bit with restless leg. And so Kay's at 70% improved right now, and hopefully over time that's going to get even more so. Not everybody's going to get 100%, but 70% is pretty good, and you're probably going to get better. And hopefully we're finding that most people, if they can't just totally get off the drugs, they can at least lessen the amount that they're taking for this. And pretty much this is done in the surgical center, outpatient, local, anesthetic IV sedation. So she was able to, get around and walk immediately afterwards. No crutches or anything like that. So, and we're actually going to probably do that at the other side, maybe in the next month or so. So, all right.
All right. Thank you, Dr.
Well, thank you. And
appreciate
it's been nice helping you.
I appreciate it.